You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, extreme smile makeovers, full mouth reconstruction. According to my first guest, he says nobody's teeth or gums are too far gone or too bad to have the smile they've always wanted. With us, we have Dr. Eugene Titov. Dr. Titov, welcome to the program.
Thank you for having me, Randy.
Now, I know you brought a stack of photos, and they're pretty dramatic. But before we get to those, for people that don't know your practice, and we invited you on the show to talk about a specific, I guess dentists call it full mouth rehabilitation, reconstruction. It's not something you say to patients, but give us a working definition of what that means.
So full mouth reconstruction, it's a dental term. We never talk outside and patients never talk about, I've done my full mouth reconstruction.
Yeah.
They tell, I just got my teeth fixed, or
Okay.
I just got a brand new smile. But in general, full mouth reconstruction, it's way deeper meaning than we think about. Let me give an example.
Okay.
You have a house,
Yeah.
and I have a house, or anyone has a house, and over time, it's got older, your carpet got bad, your roof is leaking, and especially when it's raining, right? And
Okay. Okay.
there is a smell from your old cabinets, your walls, and it's not looking good from outside. The painting, chipping, there are cracks,
Okay.
and you feel, I'm done. I'm not gonna patch those stuff. I just need a whole house reconstruction. And you done it. And now you have before house and after. And we see it's two different houses.
So that's the way you do it with teeth.
Exactly. What we see outside, this is a smile makeover. This is a brand new smile. But what's more important is what's inside. Brand new carpet, smells great, healthy environment, no
Okay.
bacteria, no infection, and you feel better. You want friends to come. This is a new chapter of your life. So full mouth reconstruction is a deep meaning. That means this is the door to your future, and your health,
Okay.
and your mental health.
And they're not quite ready to remove all their teeth.
Yeah, it's a combination of process,
So at your office, let's talk about this for a moment, because you also work with your wife, who's a general dentist,
right?
that you do pretty much everything right there. In fact, you told me in the green room what might take several specialists, like the endodontist for root canals or the person that does veneers or whatever, you do all right there. Is that right?
Exactly, absolutely.
And you have your own in-house lab where you actually make teeth, like make crowns, all right there.
Absolutely.
Elaborate on that.
There is a new definition. There is super GP. Have you heard it? Super GP.
I have not.
Super general doctor, super general dentist.
It's not a recognized
It's
specialty.
not recognized specialist, but it took us a lot of effort and time and traveling and learning and pick up small things that will help our patient to get better results, to go through smoothly, and also collaboration of the whole team, laboratory, designers, anesthesiologists, from start to finish.
They're all right there in your office.
Absolutely, next door. And I'm controlling this environment. I'm checking. I do consultation with my patients, so
Okay.
I know what they want. We cannot send to someone and explain that patient needs this and that. I'm staying and then giving my input on what kind of teeth. I want this longer, this one shorter.
So it's all done right
It's
there.
all done right there. And 2-3 hours, the full mouth reconstruction smile makeover is done right in our office. And again, my wife is a cosmetic dentist. We work together as a team as well.
Okay.
So everything that we call it super GP, it's all about our patients.
Okay. When we spoke on the phone, you were saying you were headed to Brazil to learn some new techniques to make things faster, lower downtime. Is there that much to this? Like traveling to Brazil?
Absolutely. The small thing that we learn from the world famous doctors, just one tiny detail helped me to get it quicker, easy, less invasive, we call it,
Okay.
and for the best result for the patient.
At the top of the show, I said that your teeth and gums are never too bad, never too far gone to have the smile you've always wanted. Do you believe that?
If you're healthy enough to get out of your home, get in your car, come to our office for consultation, we can do something for you. There is never far away that we can fix you and you can get your smile back, ability to chew, and we try to avoid being in a danger phase.
Okay, good. Now you brought some photos, and these are all extreme smile makeovers, as I'm calling them, full mouth reconstructions. Let's take a look.
So this lady, 94 years old, she couldn't eat any food, she couldn't smile, she hides her smile, and it compromised her lifestyle.
How did she hear about you, by the way?
She did a lot of research online, and she decided to call us,
Okay.
stop by. She had no idea about what options could be.
So even at that age, she was ashamed of her smile, like embarrassed?
Absolutely.
Really?
What life's like around her age? She wants to smile. She wants to go outside. She wants to walk around the ocean and go to restaurants. But she can't. She constantly hiding her smile. So what we've done?
Oh, wow.
Brand new smile makeover. Short appointment, very quick procedure, and now it's a happy patient.
Now you said that, you know, obviously everybody's a little bit different, but things like this, extreme smile makeovers, could be done very quickly, like in a matter of days. How many appointments sometimes?
It's a matter of hours.
Really?
And specifically for this patient, it was done in 1 day. So
Okay.
we did a consultation. We showed how the teeth gonna looks like. She called to her children and asked the permission. They all say, the medical doctor, they said, Mom, you need to do it.
94.
You deserve it.
Okay.
Same day, there's photography, scanning protocol. We don't need to go sleep because it's all about, we call it non-invasive procedure.
Okay.
Just good environment, make it comfortable, and done in 1 hour. You got brand new smile.
Looks
It's
good.
incredible.
She looks younger. What does she like the most? What it looks like or what she could eat?
Now, yes, she can eat, she can chew, she can eat fiber food, and everything get better in your health and mental health. But what's more important, she's getting compliments. She goes outside, she gets 1 compliment, another compliment, 10 compliments. Now she likes the way she smiles.
Now, getting a lot of dental work done seems very painful. What do they say?
Number 1, we numb them up.
Okay.
Pain is something that's manageable.
So they don't complain about it too much.
They're not complaining too much.
Do they
about
all
pain.
think it was going to be a lot worse?
Yeah, the expectation, well, like all people will have fear of pain when we go to the dentist.
Yeah.
And second, we do IV sedation. We go sleep. There are different levels of sedation. We have
Okay.
anesthesiologists coming. They have hospital-based anesthesiologists. The bigger the procedure, the deeper we go sleep. So we can monitor the blood pressure.
Like with her, it's just like IV sedation?
IV sedation, comfort, you know, if I want to ask her how you doing, she can reply to me, but most of the time they don't remember next day, even if I ask them something.
So who is the typical patient that comes in for these so-called extreme smile makeovers where they have a lot of problems with their teeth? Do you have a typical patient?
It's not about the typical patient. They all fall into a couple major categories.
Okay.
There are some patients that they usually go to the dentist every 6 months, they clean their teeth. There is not a lot of bacterial infection. There is nothing wrong with the teeth, but the shape and the color patient, they don't like it. They just want to change the new smile.
Okay.
And some of them, they Bruxers and they cut their teeth and they short.
When you say Bruxers, you're talking about they grind their teeth?
They grind their teeth and
Okay.
they all the way, they're halfway down. So they need to be restored back and making them longer that they can smile and show
Okay.
all the teeth. Some of them, they discolor teeth. You know, there is a medication discoloration long time in the childhood time. So they just need this normal smile makeover. We're using veneers and crowns and combinational treatment.
Okay.
And another type of patients, they're a little bit broader. Some of them, they got through a lot of dental work before. Fill the cavity, the crown failed, root canal failed, take out the tooth, bridge failed, missing teeth. So they're losing their teeth. And losing the teeth in the United States is a big problem. We have over 65 million people, they have missing more than 9 teeth.
Okay.
Another patient, they similar, they all worry about to end up in the denture. So another group of patients, they a little bit opposite. They got bad experience when they were a child. And now
With a dentist.
As a dentist. And now they're afraid to go to the doctor. And they try to skip any appointment possible. And they used to the pain level, the broken teeth, decay, cavity, they take the pills and okay, I'm fine. And they go to the dentist only to take out the tooth. And eventually, they got to the same level that they losing their teeth. So the next step they worry about is going to be a denture. We help all these patients.
But what about if they have bad gums, like bleeding gums, bad breath, loose teeth? Can they do these makeovers?
Any patient can do this. Again, most of the patients that avoid the dental appointment or dental treatment, they all have bad gums. They all have bleeding.
So what do? You clean up the infection?
There is a combination of procedures, right? We can clean the gums first. In the next appointment, we can do the full procedure in a couple hours. They've done the whole complete smile makeover. But we want to make sure they have healthy gums for sure.
Now, before we started, you were saying that, I guess as a dentist, you could spot people that aren't smiling. In a lot of other countries, they don't smile. Whereas you come here and everybody's smiling, or a lot of people are smiling. Elaborate on that. Like, how important is a smile in your opinion?
So we as a dentist, we have that small problem. Wherever I meet new person, I always look into the teeth.
Okay.
Sorry, this is our profession. But let's stay away from the dental. Let's take a look on surveys. Let's take a look on the research. If we Google it, what most attractive part in another person?
Okay.
And
it's a smile sometimes.
Smile gonna be always on the top. It's gonna be hairs and muscles and nose and eyes.
Okay.
But smile, if you have a nice hairs and nice eyes and nose, but the teeth is not looking good.
Okay.
You have a little bit, the people are gonna start judging you, like something is going on there. Or opposite, if you have just, a little bit belly and some gray hairs, but you have amazing smile. Wow, you're open, you're attractive.
Okay.
Everyone wants to talk to you. Smile is contagious. And I can tell you a little bit scientific.
Okay.
When we're happy, the brain sends signals to our muscles around the mouth, and we smile.
Okay.
Muscles send back to the brain, and it releases we call it hormones of happiness. Like
Okay.
there are endorphins, dopamine, serotonin. What they do, they decrease your stress level, they decrease your pain level, they decrease your heart rate, they decrease your blood pressure.
So you get people smiling again.
Smiling and get better, younger, and healthy. If you travel to other countries,
Okay.
and some kind of people do not smile at all, they just walk thinking about themselves. There are many reasons, the political economy, we're not about this right now. And for example, in the United States, right, we smile. You wake up, you smile. And we learn in dental school, you need to smile right in the morning to get those hormone levels in your body. Now let's check the life expectancy in those countries. It's going to be 60s, 70s. Let's check the United States. It's going to be 80s.
Because they take better care of their teeth, you think?
It's all connected. The beautiful smile you have, you smile more often, constantly. You're releasing a lot of healthy hormones in your body. You start exercising. You start eat better food. You're thinking you control your blood sugar level. Diabetes not even close here. You completely changing your life.
You see that with your patients?
Absolutely.
Like they come in like grumpy or serious. You give them their new smile, and now they change.
Absolutely.
Is it not so much they change, but they're returning back to how they used to be? Is that what you think?
They used to be a little bit long time away, because this is the long process
of getting bad teeth.
Getting back teeth. It takes years and years. So can you imagine, that time was when they were smiling, and then 20 years later it go down and down. You're not going outside too often. You're not talking to friends too much. You're not eating the good food that you want. You're not traveling. And I always tell my patient, write down that date, because this is life before the treatment.
Okay.
And there is a life after the treatment.
A new life afterwards.
We follow every patient on Facebook. We know how the life changed.
They start taking selfies.
They even delete the photos like before they were not smiling. If you go to Facebook, there's all the new.
They're all gone.
All gone, and brand new photos everywhere.
Good for you. Good for you.
Amazing.
Now, I know you have a stack of photos. I'm going to rush you a little bit because these are pretty dramatic. And I'm not trying to side with you, but these photos are dramatic.
Yes.
Let's take a look. Wow. That's got to be unusual to have teeth like that.
It's actually not unusual. They just, you never see this. They don't smile. There are many people around. Like, I can feel the whole sports stadium with the people that having the same situation, the problem with the teeth.
Okay.
Around my office in 70 miles radius, they just don't smile, and you don't know, and they don't know their option. It could be the nicest guy in the world, right? There is no judgment on the teeth, but I already see how we can fix it and how we can give the brand new smile.
Okay.
And look at this.
That is a big difference.
It's a huge difference.
It really is.
And how if you can take a look at before photo, they're losing their weight because they can't chew the healthy food. They can't bite whatever they want. And now we take a look at the after. Gain the weight, skin
He's
tone.
definitely more handsome.
More handsome, looks younger, attractive, open, smiling every day.
What does he say? Like, what's it like when they look at themselves in the mirror? What's that like?
I have an example of one of our patients. Right after we delivered the brand new smile, and she's ready to go home, stop by the restroom. 10 minutes, 15 minutes, we worry about it.
In your restroom,
In our restroom
at the office,
at
she's
the office.
not coming out.
Not coming out. I'm worried if something happened. I ask my assistant to take a look, what's going on? And patient opened the door and she's saying, I can't stop smiling. I'm watching the mirror and keep smiling and smiling and smiling. And they left home. It's a 2-hour drive. We have many patients that come from far away, even some from different states.
Okay.
2-hour drive. 1 hour later, I decided to ask, let's follow up. If everything's okay in the road, we called her back. And she said, I keep watching in the mirror inside of my car.
She can't stop looking at her teeth.
I'm looking at the teeth. 2 weeks follow up just to make sure she's doing okay. Keep smiling and smiling and smiling. So many compliments. It's something new, they forgot about how to smile.
Now, you say they all have regrets. They all regret that they didn't do it sooner.
Absolutely.
Is that the case with most of these people?
Most of the people, they regret. Again, it takes so long to get to that level that I'm enough. I need to do something. And they spend 20, 30 years suffering, struggling. And they can see how their life go down. Before they were happy to go outside and meet the friends, travel, and everything go down. And this is the only regret, absolutely.
And it changes. By looking at this guy, I think anybody looking at this would see what a big difference this makes. Okay, so what else do you have?
Take a look. Patient actually stopped by with her daughter, and consultation was about daughter. They tried to find a dental home. They tried one office, another office, and she spent all her life thinking about the kids and family, and not even thinking about her own life. And I asked her, do you eat the healthy food? How is your pain level? Do you have any bad breath?
What'd she say?
She said, you got in the right spot, And she was very skeptical because, she lost her hope. She done so many treatments and changed so many dental offices. And we just show her how it could look like on the digital, on the computer.
You show them on a computer what their teeth are going to look like.
Exactly. We designed right away. We show them how you can be looking. And it's actually, if you can see before photo, there's this gummy smile. We call it gummy smile. She smiled with.
She didn't like that.
She doesn't like it. Maybe she's not smiling. She's not even paying attention because she stopped paying attention to herself because of the teeth. So everything that could be done in multiple offices, multiple appointments, the specialists, we're done in one day. And
let's take a look.
Let's look at it. There is no there is no more gummy smile. There are multiple combination of treatment procedures that can be done.
She's got to be thrilled with that.
This is a different person. And look at the hairs, look at the eye, look at everything. I like from the female, as soon we call it smile reveal.
Smile reveal.
Reveal. When you giving the patient first time mirror right after the procedure, and when the smile, of course there are some tears of joy, but they all start touching the hairs, the females, because they start looking themselves differently.
They have to be surprised with this.
This is, would you say she look younger?
For sure.
Healthier.
For sure. Even more educated.
Educated.
I always think you were exaggerating. You were telling me what this could do for you, and then these pictures, I think, tell the story. So I'm going to rush you. What else do you have?
This is another patient.
All right.
I have multiple different stories, and this is
wow.
the
Okay.
dental phobia patient.
Afraid of the dentist.
Afraid of the dentist all his life, and wife called and scheduled appointments for him and make sure he's in the office. And finally, he decided to call us, and they did the research.
She had to call and say, did he show up?
Most likely, she did the research for him and
Okay.
make sure they come together for sure, because we love when the parents come. And full mouth reconstruction.
Let's take a look at that after.
Look at this guy. So he likes to be with his grandchildren and go to the school and events and everywhere outside, and they just love grandfather new smile.
Very nice.
Great friend of us. I have another person.
Okay.
Look how she's smiling. Her face is down, right? They
Yeah.
used to it. They hide in they smile. Some they hold in the hand. Some they put the head down. Came with the son. He lives in Canada. It was just one short, quick appointment. Son said, I want my mom brand new smile. Right now, I'm leaving. I have a flight. Amazing transformation.
Very
Smile
nice.
makeover. Combination of treatment done in one day, quick.
And like, I mean, like in office, you have like mills and printers that make crowns and all that stuff all right there. Did you do that with her?
Absolutely. Every patient
Everything is like there.
every patient got through the same
Because you're big on having the in-house lab, and we're in a hurry, but you said you have to have an in-house lab to do dentistry at the highest level. I'm paraphrasing you slightly. You believe that?
I believe it's a standard of care today.
Okay.
It's not secrets anymore. We all needs to deliver the better result for the patient, and everything needs to be done in the house.
Okay, good.
This is not a patient. Again, a lot of work done. Patient cannot chew, cannot smile. Everything is together. It's combination. Now look at this.
Oh, yeah.
Look at the hairs. Look at
I
the
would
eyes.
say she looks a lot younger.
I would say there's a sister,
Like the younger sister. You've told me patients will tell you you have changed their lives, and you disagree with that. What do you mean?
I mean, we as a doctor, we give them the tools. We open the door for them. It's not about I give them the brand new smile. The day they call to me and the day they decided to change their lives, this is the point of the new life is begin. And then when we do the procedure and they know how to use it, now they can smile, they can eat.
When you see them on the follow-ups, by the way, like they come back in for cleanings, you said sometimes they're almost unrecognizable because of the way they're acting. Is that right?
Absolutely. Sometimes I think I have a new patient in my office.
Like your assistants have to say, do you know who that is?
Exactly.
Is that right?
Because
Time for a few more. I'm going to rush you because I know you have good photos.
Look at this in our patient. How would you judge this patient?
Yeah. Well, was it hard to get her to smile in this photo or to show her teeth, I should
Absolutely. It's hard to get smile patient. And there are a combination of problems. There are gum disease, bleeding gums, the shape of the teeth, anatomy, genetics. There's all together. And she was always take care of her family and husband and kids. And again, at some point, she just decided, let me try.
Now, when you talked to her, did you know this was going to be good?
Absolutely. Look at the eyes.
Okay.
I can see it right away. I'm getting goosebumps when I'm talking about
Let's take
this.
a look at the after.
Look at this transformation.
Is that the same person?
One of my favorite patients that we've done this. Look at
That really is dramatic.
Look at the teeth. Everything is smooth. Follow the lip. We call it line angle. Every tooth was designed specifically. It's amazing transformation.
Now, what about her gums? She had bad gums. You cleaned that up?
Everything was clean. A healthy mouth right now. Chewing, skin tone, getting weight, healthy.
Now, for people just tuning in, I need to let them know we're talking about these full mouth makeovers, this full mouth reconstruction, as dentists call it. But you say you started the program with a 94-year-old. So there's lots of patients in their 70s and 80s that come to see you.
Absolutely.
All the time. Let's take a look.
Let's take a look at another patient. We're in Southwest Florida. This is a retired population. Most of our patients over 65. How's your life looks like after 65 years old when you're retired? It's all about food. It's all about social life.
That's a good point. Okay.
Eating the steaks together.
Traveling and tasting the local food.
Tasting local food. How can you taste the food if you have a bad breath, bleeding gums, you don't have ability to chew the food, to try the food you like? When you pick the food on the menu and you're just picking the food based on what I can chew, not based on the price. right?
Okay.
And then we will give it a look at this. I have two. Close up.
Handsome guy.
Handsome guy, happy guy, no more bleeding gums, no more bacterial infection in the mouth, can eat healthy food, life changed, social life, can travel.
You said something earlier that they look at their life as a before and after, like their life memories are when I got my new teeth and before I got my new teeth. Is that true?
Absolutely. Again, we like to follow every patient on social media.
And this guy, we had a discussion in the green room, but he lost out on a lot of good years, meaning most of these patients have hated their teeth and gums for years. And in one day it's done.
Correct.
Is that right?
Correct.
Okay.
The only they regret they didn't do it earlier. Just, can you imagine 20 years before how the life could be changed? Do you have time for one more?
Yes.
So I have a patient, bad teeth, can chew food, can eat anything, can taste wine, red wine, white wine, you name it. One day at barbecue party, he swallowed that metal from the cleaning brush,
Oh,
the metal
wow.
piece. Internal damage, got through multiple medical surgeries. Bad story. After about 2 years of recovery, I'm done. I need to do something. So he did the research again, stopped by our practice.
Let's take a look.
Take a look. Completely different.
Very nice.
Now this guy can eat steaks. He can buy apples. He can chew corn in the cup. You know, healthy food. You can see how the smile changed.
We are out of time. Let's say somebody with bad teeth, bad gums, bleeding gums, maybe in their 70s, 80s, whatever, and they're skeptical. They've heard what you have to say, but maybe they think their teeth and gums are just too far gone or bad. What do you say to them? They're afraid maybe to go to the dentist.
For anyone who are afraid, and you think your teeth far gone from the treatment, that you cannot get any smile back, tell me, please find your dental home. Stop by. Everything is important in our life, and health and mental health and oral health, it's all connected. Don't wait. Stop by. We have complimentary consultation.
At least know your options.
Know your options. We go through the whole process and explain you everything, show you everything, and you'll be happy.
And now, we discussed because Medicare, Medicaid, dental insurance doesn't really cover this, but you say people finance this. Is that right? You have lenders that help people with okay credit?
We're working with the highest, the best lenders in dental industry. And by the way, sometimes we got decline. We have in-house finance. We have all options to help as much as possible for the patient.
Good.
We're ready to help.
Dr. Titov, I want to thank you for coming on the show. Good stuff. And both, do they usually meet you always on the consult?
Absolutely.
Or
all
your
the time.
wife? She's also there?
I'm trying to be out every consult.
Dr. Titov, I want to thank you for coming on the show. Good stuff.
Thank you, Randy.
You've been watching the Wellness Hour, news that makes you healthier. For now, I wish you good health.